So we are going to call tonight's Board of Health meeting to order on November 2nd, 2022. This meeting is being held virtually via Zoom webinar pursuant to Governor Baker's March 2020 order suspending certain provisions of the open meeting law. And the Board of Health is recording. Is anyone else recording? Okay. So the first thing on our agenda tonight is to approve the minutes of the last meeting. So did everybody have a chance to look through the minutes from the September 21st meeting?
Mm-hmm.
Okay. Are there any?
Sorry, calendar on Apple Watch only goes out.
Apparently my Apple Watch wants to put things on the calendar. Does anyone have any additions or changes to the minutes as written?
No, look good.
Okay, can we get a motion to approve the minutes?
I motion to approve.
I second.
All right, roll call vote. Christine Johnston, aye. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
Excellent. Minutes are passed as written. All right, is there anybody here for public comment tonight?
Nope.
Okay, easy enough. So we will start with the business at hand. So Tammy, this starts with the trash and recycling program updates.
Well, it's definitely been a busy, I don't know how many, 6 weeks since we last met in the trash and recycling world of the health department. Finally, the green bags were in stock. They're now on the shelves. And as of October 24th, the increase went up from $1.75 to $2 a bag. So that went through. There was a Heart Springs truck in the town hall parking lot last weekend. It was part of a community's textiles challenge between Longmeadow and East Longmeadow. And Liz is still waiting back, but she feels like East Longmeadow won. So we'll see whether or not that's the case. And whenever they do those, it's usually a $500 prize to that town to an educational fund. Let's see. So yesterday, November 1st, was the beginning of the changes to the state's waste ban. This has been sort of a long time coming, and it started off with us working with the organics program and also kind of preparing a lot of our vendors and businesses for it. Let's see. So some of the things that we did was we met with the state DEP inspector at the transfer station to discuss the new requirements. A lot of the stuff is really just about signage and what can and can't be thrown out. We've also been working with the DPW to make sure that we have all the necessary paperwork for the certifications for the transfer station. So that's been kind of taking up a lot of time in the health department. Let's see. Next week on the 8th, we'll be working with the school department staff and Recycling Works, which is a company that not-for-profit that helps out organizations, municipalities, businesses with their recycling challenges. They're going to come with us to the school department and kind of give a brief update on the waste ban for the staff at the schools, and also kind of just to get back to basics with recycling, because I know we were in the schools, we saw a little bit of, I think there are things that could have been done better in regards to recycling, and not just the organics, but all the things that we've kind of been doing for the last 30 years in recycling. So we're doing that. So as for the organics program, so Liz has spent the last 2 months over at Meadowbrook, and now she's moving on to Mountain View. It's been doing really good. And so far, we have diverted 3,807 pounds of food waste, which is awesome. And it just, I think, as people get more comfortable with it, and as even, it's not just the kids who are throwing out the waste, there are scraps and things like that that happen in the kitchen. So I think as people are getting comfortable, we'll be generating more and more. And then kind of like the last one on that list is the waste hauler regulation. I know we've looked at it before. We did a few more tweaks on it. One of the things that we wanted to do was work on the fees that we have in the regulation. So I sent that to you guys. what we can do is, for our next meeting, we'll post it for public hearing, because this is a change to our regulation. And then we can take a look at that and review it. For the fees, I was talking to our town clerk. In January, they will be, the town council will be reviewing all of the changes that the different boards and departments made. And I guess so what we do in town is all of our fees are then approved by the town council and they are added to our bylaws. So we don't have to have public hearings and the public notice for our fee changes, but we do have to have it for our regulation changes. So we can add that to our next meeting, which I won't get ahead of myself because I put fees after tobacco. So any questions on trash and recycling? We're good. So a lot of the changes that people and businesses have to realize is, a textile does not belong in the trash. There are places to get rid of it. You can get rid of them. You can call up, if you look on our website, we have the numbers we have Heart Springs and is it like CB? I can't even think of the name of the company. We've got the company that will come to your house.
CMRK.
CMRK. I don't want to say CBGBs. CMRK can come to your house. We also have the textile bin behind the fire station as well. And that, things like, we don't want you breaking up your mattresses and putting them in the trash. You can bring them to the landfill or to the transfer station. We have ways to get rid of them that way. Other things that are textiles you think of, linens, beddings, that sort of thing. Also, we don't want those to go in the trash. Let's see. Okay, so the next thing on the list is the tobacco sales regulation. We don't have much to say, that we were never given an update on the changes to the state regulations. So I guess what we have to decide is, do we just want to go ahead and vote as is, or do we want to wait? Seeing as we don't know exactly what the changes could be. What are your thoughts?
Do we have any sort of timeline when you expect those from the state?
I sent an email to MAHB and didn't hear back from them yet for the meeting. At your Pioneer Valley meetings, you haven't heard anything either, Alex, huh?
No.
So it could just be worth it to just go ahead and go with the posting and the public hearing and go with ours, and then who knows when they'll come along the lines, and then next year we can, or we don't even have to wait that long if we want to update and approve once they come out with those regulations.
Do you think they're waiting until after the election, like the state elections next week?
I would never make any guesses.
Makes sense.
Mm-hmm.
Makes sense. Mm.
Thoughts, ladies?
I personally think we should just wait another maybe few weeks, and if they don't, we can make a decision at our next meeting. I'd hate to do this twice, you know what I mean? Like if we make one thing and then have to re-edit it again, especially if we're gonna have to do a public hearing and a formal announcement, and then we can have a special meeting, right? As far as I understand, like if we find out they make drastic changes that are different from what we've already prepared. I mean, because we've already made a lot of the changes that they suggested.
Yeah, from what I understood, it was just cleaning up not the definition section, just the data and reasoning rationale behind there at the beginning, because they just had some outdated resources.
I mean, it's not going to change anything dramatically right now. So why don't we just wait till we get the final one? Because then we can just do it one time, have the special vote and have the public hearing, and then we can go from there. That would be my suggestion.
Yeah, makes sense. I mean, we're going to meet in another month, and you may hear something by then.
And maybe we put a sort of deadline on it, like if we don't hear anything by the beginning of January, we just go ahead and do it
Right.
so that it's not just sitting outdated, out of compliance with the current regulations. Would be my thought. I'm in agreement. We'll give it a few more weeks and then if we don't hear anything, then just move forward with what we have.
Right. Okay. Yeah, I mean, we're all getting to the tail end of the year, so.
Sounds good. Sounds good. We'll put that on the next agenda then. Hopefully we'll hear. Hopefully we'll hear in the month of November. Maybe you guys are right about your ideas behind why it's taking so long. Let's see. Okay, let's see. Permit fee discussion. So, like I said, the town clerk said if we were gonna do some fee changes to kind of do them all, not all at once, but get them all together so that in January they can do the vote, so we can put that into the bylaws, which is good for some of these because if you look at the Excel fee schedule, not that first one that I had sent you, it was kind of messier. It has our renewal cycle on it. There's a good portion of our fees renew for March 1st. And most of those are our food service. And while it doesn't look like, it doesn't look like a lot reflected on here, the majority of our permits are food service permits that come in anyway. And so some of the things that we were trying to do is currently we have everything sort of under food service establishment. We have them all, we have it put out as one section for retail, one section for food service, one section for bakery, one section for supermarket. What I would like to do is just, because by the code, there is no difference in how we should be regulating these establishments. They are the same thing. They're all food service establishments. So what I'm going to want to do to make it easier is just put them all under the same tier, we're not changing the fees for those except for bakery, because bakery was 200, 300, 400. They would just fall under the exact same fee schedule as the others, 200, 500, 700. So we really wouldn't be changing anything. We'd just be streamlining it. And the only thing we'd be changing is bakery. So that's that one. Let's see. The next one is for temporary food service. Right now, it's just $45 per day. I think it would be a lot easier, and especially when we think of a lot of our temporary events, they're for organizations or they're for town events, and just to make it easier and sort of streamline a little more. So we'd still stick with the one day being $45, but then we'd do 3 tiers. So 2 to 3 days would be $75, and 4 to 14 days would be $150. A lot of things like our carnival would fit in that 3rd tier, and a temporary food service is anything that's 14 days or less. And
So
then-
now, just hypothetically speaking, thinking of like the carnival, so we're going from 45 a day to 150 lump sum total. So the carnival is, what is it, 2 weeks?
It's
10 days.
Well, 4.5.
Oh, it's 4.5.
Yeah.
Just a couple of days, I think.
I'm
And
thinking of the
most of them get a annual permit anyways.
Okay.
Oh,
So
Mhm.
again, it's not going to astronomically change the pricing of what people are going to pay. Okay, cool.
No, it actually would make it a little bit less for the people who say come to the carnival. It's they pay about 180 right now. They'd be paying 150, which is kind of more in line with what other towns do for their temporary permits.
Mhm.
And I wouldn't go any less than that. It's still a lot of work.
Mhm.
I was worried we were charging them a lot more. That's why I was at.
No. Actually, those people will be paying less.
Yeah, that's good.
Yeah.
But do we lose a lot of money then from your administrative standpoint for what you all have to do? No.
Not really.
Okay, good.
No, and we're also not the only fee that they pay too. They pay so many other fees for events like that, and they're there and they draw business into town. So
Let's see. And then if down in under the environmental section, this was what we talked about last month. We're just cleaning up the application and everything like that. And so the big thing was splitting the fee for disposal works, construction permit, and the plan review into two, because not everybody needs a plan review. So really, we're not really changing too much prices, but we're really just splitting that in half. So 200 and 150. And then we're changing the for the perk test or the soil suitability site assessment. Right now we have it $150 per hour, and we bill them afterwards, which just, no other town does that. So instead we'll just start off with the $150 for the first 2 hours. And then if they do go over it, we'll bill them for $50 an hour after that. And then let's see, the last things we have are with the waste hauling. And I think at this point, with all the changes that we've had to do with the solid waste, and sorry, there's music, the lot of work from our staff and everything like that. I think this right now, changing it from 250 to 350 is not a big, I don't think it's a big ask, especially when you look at who are most of our haulers are: Casella, Waste Management, McNamara, Republic. That's not a lot of money from them. And there are other towns that charge up to $500 for a waste hauler license. But what we did want to do was add a $50 one-time residential bulk pickup, because we have had complaints from companies that are like, well, we only come to town once and we might do like a cleanup of somebody's house. So I think that way it covers those people. It makes them more apt to actually get a license, so we know what they're picking up and when they're throwing it out, we're disposing it of. And at the same time, it kind of keeps it's not very cost prohibitive to come into town to do that work. So those were really the basic changes. I don't know if anyone has questions about that. Do we have
So
any?
the waste hauler fees in line with other communities around us, the increase. Okay.
Yeah, there's a lot of different ways that people charge for them per truck, per tonnage. It just seems to start it gets I think it gets a little too hard to sit there and have people piecemeal give us certain amounts. So I think this way, just flat for those commercial haulers, it's commercial residential dumpster companies. It doesn't, it's not on the person, it's not on the generator, basically the fee, it's on the hauler. So if you hire somebody to come clean up your house, it's the hauler that should do it. And maybe it's going to be reflected in their overall fee, but I think that with the annual license, it's not that hard. It's not that high.
And we don't have to vote on those changes. Those are just, we can say we're making the changes and it should be fine.
No, we can vote on it as a group, but we don't have to do it with public hearing. That way,
Okay.
that way the next meeting, what we'll do is we'll vote on it, and I'll give the final list to the clerk's office, and they will give that to the town council to vote into the bylaw. I like that. That makes it really easy. Like, it makes it very simple. I mean, I'm assuming I'll have to be at the town council meeting in case there are questions about it, because that's when they'll have the public hearing. But all of these make lots of sense when we're looking at it. I didn't put this in the agenda, but I guess we can, as other business. The town was awarded money, I think it was through MGM, to purchase a permitting software module. And we're going to be on the list of departments that's going to be able to go and get our permits put online first. Actually, I just received an email a couple hours ago. They're going to start working on it. So with clerks and building and health, we'll be able to have a lot of our applications online. People can pay that way. That way we don't have to walk them down to the clerk's office if they want to pay by credit card, and it makes it a lot easier. There'll be a lot less mailing that we have to do if we can send them, emails, digital notices. But one of the things is I would really like, before that happens, to start streamlining our permits. So, because some of them are a lot longer than I think they need to be. I mean, I know Alex and Renee both know sometimes we'll get these paper permits and, half of them won't even, maybe some check boxes might be checked out and a name might be put on the top, but it just becomes too much. And then take our check, take our paperwork. I can't fill it out. So that's why I think it'll make it a lot easier for some people. And then if we have the new fee schedule and everything in place by the time that happens, it could be by March that the first round goes out, the first stuff goes live. So that'll be kind of nice. It might not be in time for our March, our February, March renewal season, but at least, when we get that rolling, let's see who comes after that. A lot of our like body art and some other stuff starts in May. So maybe we'll get that by then.
You said the money's from MGM?
Yeah, Karen Halpern, who was working for us, she was able to get this grant, and I guess any of the towns that abut it.
Okay.
Yeah, and
Cool.
so they're going to put it towards the platform for our permanent, which is great.
That'll make things easier on that user end too, and on your end, easier to keep track of
Yeah,
on the town council's end.
Yeah, I'm sure that there will be lots of bumps and hiccups. That's just how the online permitting is. I've never utilized this particular. There's like two different modules that people use. There's OpenGov and there's Permitize, but I think they all are similar, which I think it would be really good if we are all on it too, because that way, if something comes into the building department and there can be a sign off for the health department. So, if anything, we can catch a lot more that goes through as if everybody's not educated on what permits go to what. I think that'd be great. Let's see. Anything else on fees, permits? Any questions you guys got?
No, so we'll put this on the agenda to vote on then next month, these fee changes. But they look good. I think you explained them really well. They make a lot of sense, and hopefully will make it easier for you and for the users, the folks who paying the fees, to like really figure out exactly, A, B, C.
I think it will. And there, I didn't want to do too much for this year, but I know there's some more stuff that we can streamline and for previous years, but I feel like this is the big stuff that really affects us, I think, the most. So we'll start with working with that. Let's see. Does anyone want to talk about COVID?
Can we talk about RSV instead?
I was saying,
Please, no one kiss children.
Oh.
Don't do it.
I was saying to the ladies, I was like, hopefully Katie will give us an update on RSV. Do you want me to go through COVID first, or do you want to?
You can do COVID first, but oh my
I've
God.
got nothing really exciting. You can really tell by the by our Maven, by our virtual epidemiological network, where the cases are reported that are done, at our CVSs or in hospitals, that it seems like more of the cases that are doing it that way, as opposed to home kits. They're probably more in hospital settings and in care settings, because the ages now are they're trending much higher than they were before. But I don't think that's really reflective in who's getting it. I think it's because people are taking the home tests, because right now, for the last reporting period, there was only 30 cases on there, but we had 12 of the 30 were over 65. So that's a good portion. I mean, that's almost half were over 65.
Well, and even in like doctor's offices now, if we're doing a rapid test, I don't think we even have to report it to the state, because they're like the rapid home tests. Whereas if it's a PCR, like obviously that automatically gets reported. But I don't know, how is it at the college? Like you guys aren't, if you're doing rapids, Christine, you're not reporting them, or?
Yeah, we're not doing PCRs anymore. Like the Broad Institute stuff that we were doing is done. So we have the capacity to do them through Bay State Reference Lab, but we're not. And honestly, what we're seeing, most of it is students calling in with their own home test. And we're just saying, cool, what do you need? Right? You hear, you move it, you're going home types of things. So no, we're not reporting those.
Yeah,
um,
same.
We're not reporting any of our rapids at all.
And I think like what you're probably going to see is their data reflected in the kids who are out of school as more of the accurate number. If you look at the percentages, and loss of work, because you still have to quarantine for the 5 days. And unfortunately, what I'm seeing now, and I don't know if this is the same for everyone else, that the people who never got it are getting it now. And those who got it really early on in the pandemic are getting it again. And the bivalent booster obviously is readily available everywhere. And I'm recommending everyone get that. Even if you had like the other booster like 2 or 3 months ago, get it. And there's new data to suggest that you probably would have a better response if you had COVID in the last like 3 months. Don't wait the full 3 months and just get the booster shot. So I mean, that's really what we're seeing, I think. And the number, like you said, it doesn't really reflect, Tammy, the actual community spread. And unfortunately, I have many people who are like, nah, I probably had it, I just didn't test, which is unfortunate.
Which is fine as long as you stay home and
Right.
isolate away from everybody. That's all we ask. If you're sick, stay home.
And
I-
wear a mask. Like, I like not being sick. I don't mind wearing a mask so I don't get sick. And if I am sick, I don't want to give it to everybody else.
Yeah, I had suggested to the employees at town hall to wear a mask over the last couple weeks because we saw a lot of cases, within town hall. And just, the smart precautions to take in those instances. And, we're still recommending, if you're a contact, wearing that mask for 10 days after, and then testing day 5 or day 6, just to make sure. I mean, I would want to know that if I've had it after that. I probably took about a dozen tests in the last 2 weeks, just in case. There's lots of sniffles, lots of allergies, whatever going around. Our vaccination rates.
So much other junk going around. So just because your COVID test is negative doesn't mean you should go out into the world. If you're sick, please stay home.
Well, and just to kind of put this in perspective, adults can get RSV. And unfortunately, like we are seeing like a triple pandemic of like RSV, the flu, and COVID. It's not like one is, RSV might be the worst one right now. Like, do not kiss babies, even if they're cute and they're not yours. Don't touch them, don't kiss them, wash your hands, stay away from them.
Mhm.
It is a crisis in New England. There is no pediatric ICU beds. None.
Mhm.
It is across the entirety of New England. Babies need to be away from anybody. And that, I know it sounds really like harsh, but the reality is like we're seeing young children get rushed to the hospital who can't breathe and are going to be put on supplemental oxygen or unfortunately put on like breathing machines. So, and adults can get RSV and it's like a mild cold to us because we've been exposed to it so many times, but babies have no immune response yet. So it's really, really important to recognize that too. And
We've
then
had so many people out sick with their kids with RSV. We've had adults with RSV. I've seen more adults in masks on campus because their kids have RSV than I have for COVID recently.
yeah.
And mono. Oh God. Let's not talk about how much mono was going around.
Really?
And it just shows like we haven't been exposed to viruses in 3 years. And now essentially we're all getting exposed to things again. And so you're going to see really bad viruses. You're going to see much sicker people again. And again, we haven't been sick. People are like, oh, I forgot what it's like to have a fever, so just being really cognizant. And if you are sick, tell people before they come over to your house and be like, hey, I kind of have the sniffles. If you want to come, that's up to you. But I think just be transparent and kind of assess your own level of risk, and then you can make an informed decision.
A few hours ago, the Massachusetts Department of Public Health put out a letter to Massachusetts families with suggestions for preventing respiratory illness. It's actually, I think it's pretty nice. It sums it up, I think, pretty well. The things that we should be doing to prevent children this fall from having disease. Basically, I think they call it the fall prevention disease letter. One was vaccinating your child ages 6 months and older against flu as soon as possible. Two, vaccinating children ages 6 months and older against COVID-19. Getting boosters also as soon as possible. Remembering that you can get a COVID-19 vaccine and flu shot at the same time. If your infant has been offered treatment with protective antibodies due to their prematurity or other condition, keep them on schedule with their monthly treatments. Practice hand hygiene, covering coughs and sneezes, cleaning high-touch surfaces, keeping children home from daycare or school if they have a fever, a cough, difficulty breathing, shortness of breath, congestion, runny nose. Avoiding social gatherings if your children are ill. I know Halloween, not the best time. And then contacting your pediatrician or healthcare provider if you believe your child needs medical care. Thought that was a pretty nice and very informative list that they gave out.
And I know strep went through the elementary school. We got it. Everybody got it. Like, and again,
And through
strep through
the
is
college
awful.
too.
Right.
Yep.
And that's so contagious too. Like, you forget.
Now,
I think, go ahead.
oh no, I was just saying our vaccination numbers for COVID got a little bit better since the last time we met. We still haven't reached 80% yet. We're at 75% fully vaccinated, 45% with their first booster dose, and 16% with the second booster dose. And obviously the lowest categories of vaccinated still are the 0 to 4 and the 5 through 11.
And it's interesting. I'm seeing a lot of people now who are who are never got vaccinated, who now want to get vaccinated. So I'm like re-educating people that they still have to get the primary series. And then when they get the booster, they can get the new bivalent booster. And now 5-year-olds and up can get the bivalent booster as well too. So that's really important.
Did that come out? The bivalent?
Yeah, for 5-year-olds, it came out. I wanna
It
say
wasn't.
maybe-
It was the week that we had our first clinic, but they didn't have that one. Big Y didn't have it yet.
Yeah.
I only asked because I asked our pediatrician about it at an annual, and I was like, what do I do? And she was like, well, you can, she was like, right now I would hold off on a couple of weeks and see what happens.
Yeah, they're
So,
recommending
good
at least 2 months since the boot. So like, I think our kids got the booster right around the same time, like right before school. Our pediatrician recommended at least 2 months,
Okay.
before you do it. So maybe like around Thanksgiving, thinking
Okay.
about doing it then.
Cool. Glad to know that one's out because I did not see that. Obviously, there wasn't as much pomp and circumstance with that one.
I do want people to recognize too, that like, if you are sick, don't not call your like team members within the healthcare team. And that there are multiple ERs in the area that if you need care, you can go to like Wing or Noble or Cooley Dickinson or even down in Connecticut. And that, Mercy and Bay State obviously are going to provide the best care that they can, but recognizing like call your primary care physician or your advanced practice provider to figure out like, where's the best place for me to go? Like, is this an ER visit? Is this my office visit? Is this like, do I go to urgent care? Because I think what we're seeing is because people are so sick, they just don't know where the appropriate places to go. And I don't know if you guys are getting calls at the, the town about like what urgent cares are open and things like that. Are you guys getting any calls like that? Because they've been calling my office like, which urgent care do we go to?
Most of the calls that I think we're getting focused on sickness and COVID are most from workplaces, wondering what they should be doing. And all of the isolation and exposure guidance on mass.gov, it might seem a little overwhelming, but if you just take a couple minutes to read through it, it is not, it's not as daunting as it looks. We're still staying home for 5 days. We're masking afterwards. If we're being exposed, it's that same time period where, nope, you do not have to stay home to quarantine, but wearing a mask for that 10 days afterwards, making sure and testing. But that doesn't sound so bad when you hear it set out, but I think when you start to look at it on a website or page, it does look a little daunting, but it's not too much to go through. And I can cover, let's see, so we had 2 drive-through flu clinics in October, and they were great. I think the one at the senior center on the 4th, I believe they said the final number was 120. And then on the 5th, I think we beat it at the fire department by 1. I think they said it was 121. So they stayed consistently busy throughout the entire time, which was fantastic. We had a lot of families show up on the second day, which was good too. And then we did 2 joint COVID and flu clinics. One was at the library and one was at the senior center. And both of them, we had about like 50 or so people show up for both of them. The library one had more families show up for both. And we saw a lot of kids get boosters and flu at the same time, which was really good to see that people were getting them done. We had a really fantastic personal preparedness talk for Preparedness Month. I think we ended up having 39 people come through and either make put together a preparedness plan or make a go-get, which was great. And we've had booths, health departments had booths at the Little E, at the COA, and at the benefits fair for retired employees, which was last week. So there's just been plenty of tiny little things peppering our time, which is kind of nice, actually. And that's all I had for my list.
That's all great. Thanks, Tammy. Very good. Cool. Anything else? Any new business or other business? Anything else going on with the health department we need to know about?
I'm sure that as soon as we get off here, one of us will be like, oh, what about the I feel like lately it's been we still have plenty of COVID test kits. So any residents who want them, they can come to the town hall. We have them at the health department. If they feel like they might be sick, just call and roll down your window and we'll throw them in your car. You don't need to come in. We're open 8 to 4 Monday through Friday. So there's got to be someone around who can at least pop outside and hand them off. We have quite a bit left. Probably half of them are still left. So it's a couple thousand. Definitely. And I know, and even if you're not sick, if you're stopping by to vote or whatnot, stop by or for early voting, I think just ended, never mind. Or you're paying your taxes, never mind. Come by and pick up a couple test kits.
Alex, Renee, anything else? Okay.
Nope.
Rebecca, Katie? Okay.
I'm
So,
good.
oh, go ahead.
No, I sound good.
So the next thing on our agenda is to set a next meeting date. And we're starting to get into that time of the year where it gets a little, not that it isn't always crazy. And I recognize we all have crazy schedules, but you start to throw November and December onto this and it gets even crazier. So Tammy, did we say we need to do a public hearing meeting?
It depends well, okay, actually, if we even if we're not doing tobacco, we would just need to post for the hauler regulations.
Right.
I don't see there won't be much issue with that. We're adopting state language and there's a lot of new stuff. I think people shouldn't be surprised that we're doing for language. So
Right. That's not
but
going to be
the next meeting we'll have to post it.
Okay.
Does anyone have any conflicts on certain days in December?
Just the first 2 Tuesdays. I
Okay.
think it's the 6th and the 13th. I can.
What about Wednesdays?
Wednesdays, I'm good. Any other
What about-
day.
What about you, Christine? I know you
No,
had
I'm
some.
generally good. I've got a couple of random Tuesdays I probably can't do. Wednesdays. The only one that looks like I might not be able to do is the 7th. It's the high school band concert night.
Okay.
But if we wanted to do the 30th, I don't know if it's like a whole month away.
I can't do the 30th.
Of December.
No, of November.
I won't be around.
Okay.
Of the 14th.
Or I could do earlier on the 7th.
Like what time?
Like, I just have to be at the high school by 7. And it's only 10 minutes away. So 5:30 I could do. But I know that gets hard for folks.
Do we have to do that long meeting though? Because do you think it'll be longer because we have to do the vote?
Doubt it.
Okay. I mean, I could do the 7th at 5:30, or I could do the 14th at 6.
Either one.
Either one works for me. Do the 5:30?
Sure.
Okay.
Tammy, Renee, Alex, is that fine?
Mhm.
Sounds good.
Thanks all for accommodating that.
Of course, being at the band concert is important.
I mean, there's a way to get out of it sometimes, but
Wait, is
You
it
know.
the high school or is it the middle school? What is it for?
the high school. So the oldest is a senior, so it's the last round of and I got out of a bunch of them, right, because of COVID.
Mhm.
But this
When
is
it's
the
a
last
wind
one.
instrument, right? So that no one was playing those for a while.
Yeah, and then they would like do a concert, but like not invite people or. Okay. All right, so we've got that. So I guess we just need a motion to adjourn.
I motion to adjourn.
Second.
Right. Christine Johnston, I, Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right, meeting adjourned.
All right. Be safe,
Okay.
everybody.